Also, non-binary Ballet, an Oakland-based dance company that defies traditional heteronormative gender roles, is holding performances this weekend. But first, major news. The CDC has just issued new metrics that would allow 70% of Americans to remove their masks indoors. Take a look at this map. Don't have the map for you, but let me just tell you that counties with low to medium risk under a new COVID-19 community level, so they would no longer need to mask, right? And that's a new metric. There you go. Okay, so if you're in yellow or green, as you can see, just about the Bay Area is, except for Napa, Solano, and Santa Cruz counties. Those three are still in orange, which is high. But the other counties, essentially, according to the CDC guidance, can now get rid of the mask, or at least make it optional. So a lot going on here, and joining us to talk about this is ABC7 special correspondent, Dr. Alok Patel. Dr. Patel, my goodness, does the CDC, tell us about this. It doesn't seem like they're differentiating between unvaccinated and vaccinated people, and it doesn't seem like they're differentiating between schools and other indoor environments. Am I reading this correctly?
Kristen, you are. And there's a lot of confusion swirling around right now on Twitter as people are comparing these two maps. What these two maps are basically looking at, when I say two maps, I mean the old one where the entire United States looked red, and the new one, which shows a lot more of that green and yellow, is one of these.
Let's go ahead and throw that up if we can while Dr. Patel is telling us about it, because people are looking at these two going, what's going on? Thought we were just all in red. Yeah.
Now, the one that you see that's all red, that is community transmission. Those are just cases out of 100,000. And just as of 3 days ago, the entire country was reported to be in, I shouldn't say entire country, but more than 90% of counties were in high transmission. Now, the new metric is actually going to be looking at COVID-19 community transmission. And there's going to be some metrics that take into account there, including cases, but also the amount of COVID-19 cases that are being admitted to the hospital and hospital capacity. So, Kristen, it's a little bit more of a broad category, but it factors in a county's ability to care for those who are most risk and also have the hospital capacity. So in all honesty, this metric actually makes a little bit more sense, but because it's not necessarily clear, and it seems like 70% of the country all of a sudden got lifted to low and medium, there's a lot of confusion out there. But as you alluded to earlier, this now means that the overwhelming majority of counties in the United States have lifted or are able to lift, according to CDC guidance, the indoor mask mandate.
Okay, so let's just leave that up there for another second, because I think, like you said, there's so much confusion. So director, producer, if we can put that map back up, the side by side. The red, that one is the old kind of transmission looking at cases. And you're telling me what they're relying on now in announcing that, about 70% of Americans can now go mask optional. Looking at the left side, that's what they're going by with the yellow, orange, and green. That's based on, you're talking about hospital beds and taking into effect really what they think the danger level is, if you will, not just cases. Is that what you're saying?
Absolutely. Those three metrics are new COVID-19 admissions, the percent of staffed inpatient beds occupied by COVID-19 patients, and total new COVID-19 cases. Those are the three metrics that anyone can look up. You can punch in your county and look to see immediately what that risk level is. And, Kristen, I think the baseline thought now is that we're not going to get to zero cases. So just looking at case number is not feasible. We need to have a little bit more of a way to gauge how to live with the virus while protecting those who are at most risk. And I will tell you, punching in the county and looking at your relative level of risk kind of reminds me of when we have bad air quality in the Bay Area, and you look up the air quality outside and you can make an assessment about what you should be doing based on your individual risk. And I think that's where we're headed.
Okay. Are there exceptions, environments where you still have to mask, even if you're in one of those yellow or green counties?
Absolutely. If you actually look at the bottom of the new chart on the CDC's website, there's an asterisk, and it says, if you have tested positive, or if you have symptoms, or if you've been exposed to COVID-19, you should still be wearing a mask. That is a recommendation. Obviously, in about 30% of counties that are still considered to have a high level of that COVID-19 community transmission with new metrics, indoor masks are still recommended. And the CDC stresses again that masks are still a good option for anyone out there who is high risk or has specific concerns. About 40% of counties that are in medium, if you are high risk, it is recommended you chat with your doctor about what you should be doing, but when in doubt, still wear a mask.
Doesn't this almost make it a sure thing, though, you think, that when the State Health and Human Services Secretary, Dr. Mark Galley, on Monday addresses what they're going to do about the school mask mandate, doesn't this kind of assure that they'll have to lift it because the CDC is not differentiating and saying different rules for schools, and we've already lifted it overall?
President, it seems that way, and that is what my expectation will be. I think there's going to be a little bit more of a nuanced discussion with what local school districts are able to do. Because if you look at these different tiers of risk, there's different kind of resources and community level intervention. So I think the schools are going to ultimately be the ones to decide. But the CDC traditionally has been more conservative than what states have been doing. As we know, the majority of states have already lifted these mask mandates and are kind of heading down their way towards calling this an endemic virus. And so it would be interesting if all of a sudden K through 12 schools followed a more strict path than the CDC does. But hey, crazier things have happened in communication throughout this pandemic.
Indeed. There are some people, though, as you said, there's all differing reactions on social media. Some people say this is kind of like the CDC throwing immunocompromised people under the bus. Is there any truth to that?
I understand why those who are immunocompromised or those who are not yet eligible for a vaccine, or I should say parents of those who are not eligible, could kind of feel that increased risk. And the CDC probably has a lot of pressure on them right now because the majority of the country is moving in one direction. But I really feel for those who are at high risk, those who are immunocompromised. And that's why we've stressed over and over again that people, when you're getting vaccinated, you're doing it not just for yourself, but for those around you, reducing that level of community transmission. And so hopefully those people are protected by those around them. And the immunocompromised people are still in that category where they should be wearing a mask. Even if you're wearing a mask and others around you are not, we're hoping that they're vaccinated, you still get a good level of protection.
Okay. Hey, as if there's not enough news, real quickly, I just want to mention that we just got word that Governor Newsom has issued an executive order, and he's going to lift a series of statewide orders issued during the pandemic. Overall, the emergency declaration still stays, but he's lifting a large chunk of kind of COVID-related executive actions. We're still digesting that, processing that. I don't see anything immediate about schools and masks, but we'll continue to sort through that and bring that to you. But Dr. Patel, also really important, the CDC made a change in how the vaccine doses are spaced out, right? That's the other big headline out of the CDC.
That was, and it was kind of buried throughout all the news of the week, but essentially the spacing now between the first two doses of the mRNA vaccine, Pfizer and Moderna, the recommendation is 3 to 8 weeks, with 8 weeks actually being optimal if you have no underlying medical conditions and you're in that 18 to 39 age range. The thought is that spacing the vaccines out will actually give you a better antibody response and reduce the risk of the already incredibly rare myocarditis, which hopefully could give some people out there who are vaccine hesitant, maybe it's because of the spacing or myocarditis, a little bit more relief. So that was another change that we saw earlier this week.
Okay. Here's a viewer question. Bess wants to know about masking in subways, ride shares, airplanes. Dr. Patel, I think we addressed this, that on public transit, airplanes certainly flying, they're still recommending or telling you that you should keep your mask on. Ride share, that's kind of a private business. And I know private businesses have their own rules. And that's the bottom line, right? If the business you're visiting, grocery store, whatever, still says we want you to mask, don't fight it. Just mask, right?
Don't fight it, just mask. I'm still going to be carrying a mask on me, even though it's nice to take it off when I go to the gym because, you know, I have an unvaccinated and very adorable 10-month-old. So if I go to a store and it's crowded, I can't tell if everyone around me is vaccinated. I don't care what the community transmission level is. I'm just going to wear a mask.
Okay. Vivian wants to know, does my 17-year-old with type 1 diabetes need his 4th dose, obviously with appropriate spacing?
So we don't yet have a recommendation for 4th doses in anyone aside from those who are immunocompromised. And this is an ongoing discussion because in other countries, you know, Israel, Sweden, a 4th dose has been authorized for some elderly populations, including over 80 in Sweden. So I would just hang tight because a 17-year-old is still getting really good, like phenomenal protection from those 2 doses and hopefully a booster out there. But for anyone out there who has underlying medical conditions and wants to ask about their immune level and if they need a 4th dose, chat with your doctor. It's my famous phrase.
Okay. Look, I know Omicron's coming down, cases are coming down, but it's important to note, I think I read COVID is still killing more people now than during most of the pandemic. Is that right?
Death levels are still incredibly high, Kristen. And, that's why when people say we're done with COVID, it's hard to be done with something that can kill over 1,000 Americans a day. And, I hope that we never learn to normalize these numbers. But again, as we move into this new level, we start to look at the new CDC guidelines, it's important that we're paying attention to hospital capacity. And we're taking into account that these guidelines were made with the fact that we not only have vaccines, but we have a lot more therapeutics available as well. And so, people are still inevitably, ultimately, going to still get sick, some who are severely ill, but hopefully with the new metrics, we will know that those counties have the hospital capacity to take care of them and get that death level lower, save more lives.
Yep. All right, Dr. Alok Patel, great to see you. Thank you so much. Have a great weekend.
Happy Friday, Kristen.
Talk soon. All right, coming up when we come back, a look at what's behind the Bay Area protests against the Russian invasion of Ukraine. We'll be right back. All right, everybody, thank you for joining us. Always great to have Dr. Patel. Thanks for your great questions. All right, as we prep for the next segment, we'll take a short break and enjoy this view of the Bay Bridge. More rallies to support Ukraine will be held in the Bay Area this weekend as Russia continues its invasion of its neighboring democratic country. Reporting on people who stand up for justice is part of building a better Bay Area, a mission we share with our media partner, the San Francisco Standard. Joining us now to talk about local efforts to help Ukraine and the people of Ukraine is the Director of Multimedia for the San Francisco Standard, Sophie Behrman. Sophie, thanks for coming on today. Nice to have you.
Thanks for having us, Kristen.
I know you were out there at City Hall in San Francisco all night. Tell us what you saw there at that rally.
Yeah, so this is a rally that was held yesterday at 4 p.m. outside of City Hall, as you said. I got there right at 4, and there were already hundreds of people. The crowd then swelled to over 1,000. It was a very colorful rally, but it was also very somber. So there was the blue and yellow Ukrainian flag. There were people holding signs saying, please no war and Putin stop. There were also some tears. I think the general sense I got from the crowd, and I spoke to around a dozen people, is just a sense of helplessness and powerlessness as they're watching what's happening unfold.
Who were these protesters? Were they young? Were they old? Were they, peace activists who had gone to many protests before? Were they people who had family connections? Who were they?
It was everyone, Kristen. I saw people who were elderly. I saw very young people. There were families. There were strollers. Most of the folks that I talked to were Ukrainians who are here because they've been working here, some for 8 years, some for less. I spoke to one woman who said that she, for the prior 3 weeks, had been trying to convince her family in Kiev to come stay with her. And up to 48 hours ago, they just didn't think that the threat was really going to pan out the way it has. And now she's just, watching from afar again. But really, it was a huge crowd of people around the Bay whose hearts are sort of with Ukraine as this is happening.
Yeah. Wow, sounds like her family didn't think Putin would actually go that far and actually do it. Was there anybody else's story that touched you in particular?
I spoke to an older German man, actually, who said that his heart was with Ukraine because his own country had sort of done their own atrocities to Ukrainians, decades prior, and now he just wanted to stand with Ukrainians and show up. He also noted that City Hall at that point was not lit up in blue and yellow. Other places around the country and even the world are doing that. And I did just hear from the mayor's office that this weekend, City Hall, both Saturday and Sunday, will have the colors of the Ukrainian flag. So I thought he was an interesting character to talk to as well.
Oh, all right. And, as you talk to people, did you get a sense for what they wanted the U.S. to do, right? Because President Biden has worked in conjunction with NATO to have strong economic sanctions, just today adding Putin himself to try to cut off the money. What did you hear from the protesters, though? Do they think that is enough? Do they think that will work? Do they want something else?
I think people are at a loss. They're just watching this happen, escalating so quickly. There wasn't a great articulation of really what they wanted. And certainly sanctions did come up. State Senator Scott Wiener also spoke and also has tweeted about the issue and said that the U.S. needs to be a sanctuary for refugees from Ukraine as they come. So that was a theme that I heard as well. But right now it was, again, just a really sense of confusion. A lot of people shared the theme that it felt like their own family was being attacked, like attacking a brother or a sister. So sort of just jaw-dropping at what was happening.
When I look at these signs and I look at the people packing that area in front of City Hall, I think, this is really in keeping with San Francisco's tradition of being a place of dissent, a place of political activism, of free speech. Did you have a sense for that?
Absolutely. It felt like the community had just sort of soared to City Hall. We didn't have a lot of notice that this rally was happening, and yet word got around. And again, of course, there were a lot of Ukrainians there, but there were also people who, just saw that this was happening and wanted to show their support. There were cars, driving by honking. So it definitely felt sort of in line with San Francisco's ethos of being a place where people stand up for what they believe in.
I don't know if this is something the folks who are out there referred to, but we saw on TV and on social media that Russian people were in the streets in Russia protesting as well, and some were being arrested. Did the folks who were out there that you talked to make a distinction between Putin and the country of Russia and the Russian people?
Absolutely, Kristen, definitely. I think that's a really important distinction. There's actually a Russian spa in San Francisco that I just read about in SF Gate that is opening up, free to Ukrainians, saying, we are your allies. We do not support what is happening. Come seek some little comfort that we can give. And I think we're going to see more and more of that as, people stand up for Ukrainians, of course, but as Russians here and abroad, speak their feelings about the issue as well.
All right, real quickly, what other rallies are coming up this weekend?
I'll have to keep an eye out for that and keep you guys posted. My guess is a lot is going to be happening. Again, keep an eye out for City Hall in blue and yellow. Berkeley will be flying a flag starting Monday, Ukrainians' flag. So there is a lot happening, and we'll definitely keep you guys abreast.
All right. And I think there's one at the Ferry Building tomorrow at 12 as well, organized by Nova Ukraine. So a lot going on. And Sophie Behrman, thank you so much for sharing your insights from the rally last night in front of San Francisco City Hall. Appreciate it.
Of course.
We have links to the San Francisco Standard's other original reporting on our website, abc7news.com. To watch more of their videos, check out our ABC7 Bay Area streaming TV app. We'll be right back. Oh, the story of a ballet company that's pushing the boundaries of what you might expect from a ballet. Don't want to miss that. All right, everybody, thank you so much. I'm super excited about this last segment, ballet, as you've never seen it before. We'll be right back. To finish off the week here on Getting Answers, we're going to look at a ballet company that's breaking all the rules. It's called Ballet 22, and it proudly performs non-binary ballet. Joining us now are Ballet 22's Executive Director, Teresa Knudsen, and Artistic Director, Roberto Vega Ortiz. Thank you, both of you, Teresa and Roberto, for joining us today. Wait, we have a third. Who's
Yes.
the third?
I'm Carlos Hopui.
Hi, Carlos. Nice to have you
Hi.
on as well, a bonus. Before we get on with this, Teresa, you also have the title of Ballet Mistress, which I love. What does that mean? What's a Ballet Mistress?
A ballet mistress helps give class and helps give notes. I also film rehearsal and really actually Carlos does a lot of ballet master work, which is the male version of the same role. So we're really honored to have Carlos with here as both a dancer and a rehearsal coach.
Well, got it. This is for any of you. What's the idea behind Ballet 22? Who makes up this company?
So Ballet 22 was founded by myself and Roberto Vega Ortiz. The company pushes boundaries in ballet by breaking gender stereotypes, specifically by presenting men and non-binary dancers on pointe. Pointe shoes are usually reserved for only women in the ballet world, and so we're breaking that tradition and presenting men and non-binary dancers on pointe in a way that feels authentic to them outside of drag.
Can I ask one of the dancers, how it feels to be able to do more than just kind of be the guy who does the lifting and the spinning of their female partner, who's really the star, if you will, right, who's spinning around on pointe shoes? What do you think?
It's just to be, it feels amazing to be yourself and be able to dance as you, not as a female or as a male character. It's just, an expression, and you can do it however you feel, just to use another type of element, which is the pointe shoe.
Yeah, and to be able to kind of go back and forth, I guess, with this gendered roles, and be able to do both, it's actually pretty amazing.
Yeah, I mean, you would think that something like this would have been around for a while now, but actually it hasn't. I mean, your company is fairly new, right? Did I read you started during the pandemic?
Yes, we started in October of 2020.
And then, what got you going? And I guess, since then, have you been able to perform?
Yeah, so in October, we decided, hey, let's do a digital show. There's this large community of men and non-binary dancers who just would love to use the pointe shoe as a tool of expression and not as a way to do female impersonation. And we realized that this was missing in the field and that it was needed and necessary. And so Roberto and myself started this company, and we rented out a theater, we got dancers, and we created our first digital show. And from there, we've been able to perform live 3 times. We did our first live show in June, and then again in September, and now we're back at the Great Star Theater in San Francisco for a show this weekend in February.
Oh, I'm going to have you tell us all about how to get tickets and how many shows, that's for sure. But I'm still mesmerized by just the dancing. I wonder if you are relying on non-traditional ballets, or are you taking traditional ballets and doing a twist on it?
So I think this is what's pretty unique from us. It's, yes, we are creating new ballets. Yes, we are, going into the contemporary world. We're also reinventing the classical works that already exist and that we love so deeply. And I think that's what makes us so different. Nobody, if they kind of break the gender norms, and it's more in contemporary dance. So not really in ballet and, doing the same Swan Lake, the same classicals, the Nutcracker, Swan Lake, the Sleeping Beauty. So yes.
So which are the shows that you have tackled, and which ones do you have coming up? What are you doing this weekend?
So this weekend we have excerpts from Swan Lake, which is our classical ballet we'll be presenting. And then we go into the contemporary world. We're going to present a piece by Annabelle Lopez Ochoa and Ramon Oler. Both of these ballets are contemporary ballets. Annabelle's piece was created on a male and female and has been recreated for the company. And then Ramon's piece was actually created on the company in September. And then the ballet is going to finish with a brand new world premiere by Durante Verzola. And this piece was also created specifically for men on pointe. So it's, you know, a great exploration into the field and a new repertoire that would otherwise not exist.
It's beautiful. What kind of feedback have you gotten from the audience? I know you've only done the digital version, but what are you hearing?
Yeah, people love it. I think people are hungry for something new. They're hungry for authentic experiences, and I would say one of the biggest pieces of feedback we get is just the dancers are free and they're full of joy, and that's something that resonates with everybody.
All right, so should people go to ballet22.com for tickets for shows starting tonight?
Yes.
Yeah, /events.
Oh, /events. All right, at the Great Star Theater in San Francisco's Chinatown. We'll take a short break, but you can join us on Facebook Live to continue the conversation. All right. Hey, so we're still here, Teresa, Roberto, and Carlos, to wrap things up. We have a couple minutes on Facebook Live. We have finished the on-air portion of what we do. Where did the name Ballet 22 come from? I'm sure the 22 means something, and I kept guessing. I didn't want to ask because I was hoping I would just get it, but it hasn't come to me yet.
Oh, this story is so, it's like a brainstorm session just turned into Ballet 22. Basically, Roberto speaks 3 languages, Spanish, English, and Portuguese in that order. And we were just trying to find something that really brought together our idea that this company is for everyone, it's universal. And so in mixing and mashing up words, we came up with Ballet 22, and we wanted it to be something that could be said in any language. So, for example, in Spanish, it's Ballet 22, and whatever language you speak, you can say it. So, just something accessible.
Got it. Okay, it's not that one of you loves Catch 22 and wanted to like play off of that, huh? Okay, well, I wonder how it is to, because I know I did very little ballet when I was a little kid, never really got to point shoes, but I know that to master that is something that takes years and years and years. And you're talking about kind of starting at a point where you're already a professional dancer, having had tons of training, and then moving into point shoes. How does that work? Is that a challenge? Is that different? Is that weird?
Definitely a challenge.
It's a challenge, yeah, because our body, we weigh more than a female does.
Yeah.
So to be able to get on point shoes is a little harder for us. The way is like more pain in the toes, for sure.
Oh, yeah. Oh, that's what I meant by weird. Your feet are going, I've never felt this before. Ouch, ouch. What are you doing to me?
Yeah, exactly. And I think it also comes with
Oh, we are out of time. I'm so sorry, but I hope everybody goes to see your show. It's fantastic. Thank you so much.
Thank you.
Oh, that looked fabulous. All right, coming back out. Thank you so much for joining us on this interactive show, Getting Answers. We'll be here every weekday at 3 on air and on live stream answering your questions. World News Tonight is coming up next, and I'll see you back here at 4.